Urinary tract infection, UTI. A urinary tract infection, UTI, is an infection that affects any part of the urinary system, which includes the kidneys, ureters, bladder, and urethra. UTIs are common and typically caused by bacteria entering the urinary tract. The most common UTI involves the bladder and is called cystitis, but infections can also affect the kidneys, pyelonephritis, or the urethra, urethritis. 1. Causes. UTIs are usually caused by bacteria, but in some cases, fungi or viruses can also cause infections. The primary bacteria responsible for UTIs are Escherichia coli, E. coli, which are normally found in the intestines. Common causes and risk factors include 1. Bacterial entry. Bacteria from the bowel, vagina, or skin can enter the urinary tract and cause an infection. 2. Sexual activity. Increased sexual activity can introduce bacteria into the urinary tract. 3. Poor hygiene. Improper wiping or hygiene can introduce bacteria into the urethra. 4. Urinary retention. Not fully emptying the bladder can cause bacteria to grow. 5. Catheter use. A urinary catheter can introduce bacteria into the urinary system. 6. Weakened immune system. Conditions like diabetes or medications that suppress the immune system can increase the risk. 7. Hormonal changes. In women, hormonal shifts, for example, pregnancy or menopause, can increase the likelihood of UTIs. 8. Anatomical issues. Some people may have anatomical abnormalities that make them more susceptible to infections. 2. Symptoms. Symptoms of a UTI can vary based on the location and severity of the infection. Common symptoms include 1. Frequent, urgent need to urinate, even if little comes out. 2. Pain or burning sensation while urinating. 3. Cloudy or strong-smelling urine. 4. Blood in the urine, hematuria, which may appear pink, red, or brown. 5. Lower abdominal or pelvic pain. 6. Feeling of incomplete bladder emptying. 7. Fever, chills, nausea, or vomiting, more common in kidney infections. 8. Back or side pain, flank pain, which may indicate a kidney infection. 9. General malaise, feeling unwell. 3. Treatment. The treatment for a UTI generally involves antibiotics to eliminate the infection. The choice of antibiotics depends on the type of bacteria causing the infection and the patient's medical history. Common treatments include 1. Antibiotics. First-line treatment includes medications like nitrofurantoin, trimethoprim sulfamethoxazole, or fosfomycin. If symptoms are severe or there is a more complicated infection, a healthcare provider may prescribe ciprofloxacin or other stronger antibiotics. 2. Pain relief. Over-the-counter pain relievers like phenazopyridine, which numbs the urinary tract, can help alleviate discomfort. 3. Hydration. Drinking plenty of water can help flush out bacteria from the urinary tract. For severe infections, especially if they involve the kidneys or if the infection is recurrent, a patient may require intravenous antibiotics or hospitalization. 4. Prevention. While it's not always possible to prevent a UTI, several steps can reduce the risk. 1. Hydration. Drinking plenty of water helps flush bacteria from the urinary system. 2. Urinate frequently. Avoid holding urine for long periods, which can increase the chance of infection. 3. Wipe front to back. This helps prevent bacteria from the anus from spreading to the urethra, particularly in females. 4. Urinate after intercourse. This can help flush out bacteria introduced during sexual activity. 5. Avoid irritating feminine products, such as sprays, powders, or douches that can irritate the urinary tract. 6. Wear breathable clothing. Cotton underwear and loose-fitting clothes can help reduce moisture buildup and bacterial growth. 7. Cranberry supplements or juice. Some evidence suggests that cranberry may help prevent UTIs, though it should not be relied on as a primary treatment. In summary, a UTI is a common infection that can cause significant discomfort but is generally treatable with antibiotics. Prompt treatment is essential to prevent complications, especially if the infection affects the kidneys. Preventative measures can help reduce the risk of developing UTI.